Now, if the patient cannot read the 160, so as per the procedure, the first procedure is the counting finger, also called as the clinically it is denoted as CF. So this counting finger means that the examiner or the optometrist stands in front of the patient with his finger one or two and ask the patient to answer how many fingers are there. So like this, so this counting finger should be started at 3 meter distance. If the patient can answer correctly, then we record the counting finger or CF at 3 meter. Then we, if the patient cannot answer, then we decrease the distance from 2 meter. And if the patient cannot answer, then we decrease the distance up to 1 meter. And if even if the patient cannot answer correctly at 1 meter distance, how many fingers are there, so we need to place the finger at very close to close position of the patient's face, also recording as the CF. Means counting finger close to face. Okay. Now if the patient even fail to the CF, means the counting finger close to face, then we proceed for the hand movement. Hand movement means that the examiner stands in front of the patient and moves his or her hand and ask the patient whether she or he can understand that anything or any object is moving in front of her or his eyes. So like this way, so this is the example of clinical example of the counting this is the clinical example of the hand movement when the patient fails to the counting finger close to face. Okay. Now if the patient even fail or cannot tell in the hand movement, then the next procedure is the projection of rays, also clinically called as the PR. So projection of rays is done with a pen torch light. So in front of the patient, we will project the pen torch in the four directions: in the superior direction, inferior, temporal, and nasal. So means if this is the patient, if here is the patient, firstly we lighten up the pen torch at the superior direction, then at the inferior direction, then at the temporal direction, and then at the nasal direction, and ask the patient whether he can understand that light is projecting at which direction. Okay. And we record the PR visual acuity like this way. So if the patient can answer correctly about the direction of the light, then we record as PR, and in all quadrant there is positive, means the patient answer correctly. But if the patient cannot answer correctly, then we record PR like this way. Here is negative, here is negative, and if the patient answer correctly at the two direction but not at all directions, so the superior and nasal is negative, and let's suppose the temporal and inferior the patient answer correctly, so it is positive. Okay. So now if the patient even fail in the projection of the rays test, in the PR test, then the next procedure we should follow is the perception of light. So perception of light means we will just switch on a pen torch light, a bright source of light in front of the patient eye, and we'll ask the patient whether he or she can see that a source of light is just switched on in front of his or her eyes. Okay. And this is recorded as like this, means that if the patient cannot see that light rays, then we record this as NPL, means no PL, or it can be recorded as PL negative if the patient cannot see the light rays. Okay. And it is in the it is again done in the fourth quadrant, and then it is recorded as NPL, that means a no PL, or it is represented the cross. Or if the patient can see this light in front in any direction, then we put the tick mark or record it as the PL positive. Okay. And if the patient, if any patient's visual acuity is proved as PL negative, means there is no light perception, the patient is called a blind patient. Okay, so this is all about the visual acuity measurement and its detailed procedure. Hope you like our video. If you have any doubt or regarding this visual acuity, you can question in the comment section. So thank you, and subscribe my channel for more updates. Thank you.